some strains of influenza to affect the GI tract, but most of the time it's probably something else. There's a whole bunch of different viruses that circulate out there, and there's very uncommonly it's bacterial. Very often it's some kind of intolerance to food or something like that. So it's hard to call it stomach flu. Regardless, you can't treat it. At least you can't treat it with antibiotics, and you probably can't treat it with the Relenza and Tamivir that we talked about that's being withheld for for the early stages of flu. By the way, I just want to mention about Relenza and Tamivir. This fall, when we started talking about avian flu and got everybody all excited and everything about it, a lot of people picked up very quickly on the idea that Tamivir, especially, and Relenza maybe, might protect against it. And they began to get prescriptions for it and hoard it.
Yes.
And that created a shortage. And even more interesting about the hoarding is governments in different parts of the world began to accumulate supplies of it. And I'm not accusing them of hoarding it. It's probably a good idea if they have it, that they have it, so long as they can be trusted to distribute it in some way that makes sense to the population if it's useful. Well, we're not certain it's going to be useful. Second, the more often it's used, the more likely resistance can develop to them also. And
pretty scary.
You know, and thirdly, it's expensive and silly, and if it keeps it out of the hands of people who eventually might be able to use it. I know that everybody wants to look out for themselves, but it's not particularly responsible.
It's not unlike the anthrax scare and that ciprofloxacin. I remember you couldn't find a bottle of ciprofloxacin anywhere, even to stock on a drugstore shelf. So that was pretty similar. Although
that makes more sense because we know that
works.
That probably would work. We really don't know this about the Tamivir.
With those other products, such as the Tamiflu and the Relenza, what I understood them to be is being effective only in a very small window of time and exposure. And if you took it much past that, it was almost moot point to take that anyways. With the traditional flu for which it was tested, let alone something avian, which only the most speculative scientists could prognosticate whether or not that would work, interestingly enough.
You can offer your opinion and you'll be as likely to be right or wrong as anyone else.
Right. How about over-the-counter relievers? So let's say, for example, my physician says, what you have, it's viral, can't give you an antibiotic, it'll do nothing. What can I do to help with some of these symptoms, such as flu symptoms you were describing earlier?
Well, if you just want to talk about viral infections, the respiratory tract, which most of us call that a cold, or in its more severe form, influenza. First, there is nothing you can do over the counter that will shorten it, decrease the likelihood that you will have, a complication or something more serious happen from it, or prevent it. There's nothing that you can do over the counter. However, if you have a really tough fever, in adults, not in children, but in adults, you can take fever reducers. If your nose is running all the time and you're dripping onto the papers at work, or you're just absolutely miserable with your nose being blocked, you can try to take nasal decongestants. The most common one is probably pseudoephedrine, and there's some regulatory news about that particular product. And the old saltwater gargle, which is half a teaspoonful in a full cup of water, not as salty as you can stand it, but just a half a teaspoonful cup of water. That's actually useful. If you stick to that and really use it, your throat really does feel better. I'm always skeptical. I'm always thinking, it's a waste of time. And then when I get one and I do it, I say, well, this really works. It really does feel better. But I guess what I'm saying is you can make some of the symptoms improve a little bit, but you really can't change the course of it. It still has to run its course. And that includes giving antibiotics. Your antibiotics aren't going to make the cold better.
And like you were mentioning with the antibiotic side effects, certainly I would think over-the-counter medications would have their own gamut of side effects. I have to be honest, Fred, you were my professor back in pharmacy school, and I remember one of the things that they taught us the first day we went in was a description of a particular medication and very scary side effects. And at the end of reading this, they asked us, would you ever take this medication? Well, we unanimously said, absolutely not. I mean, it was awfully scary. It was for aspirin, you know, and that's something that you can get over the counter. What do you think about the over-the-counter warnings and possible side effects with those drugs? Are they without risk?
Okay.
From your perspective?
Well, drugs are made over the counter by the Food and Drug Administration, not because they're effective, although they want it to be effective, but they're usually appointed over the counter because if you use it as the package labeling instructs, it's going to be safe almost all the time. There are no guarantees, and any time that you put a drug in your body, there's a potential for something to go wrong. There's a small number of drugs that almost nothing is reported on, but all drugs carry a risk. I think most consumers know that, but when the rubber meets the road and you're feeling bad,
you want
just
relief.
say, I really want something here, and it's frustrating from one perspective in that nothing's perfect, and nothing really gives relief like waiting it out does.
How about herbals and those medications or drugs that are really not a medication? What about herbals? Those are probably risk-free,
Okay,
right?
well, you didn't tell me you were going to ask me about herbals, but let me talk about that.
Okay.
The most common thing that's used is echinacea. A lot of people have a lot of confidence in echinacea. I'm not here to tell those people they're wrong or to make you feel bad about it if you like echinacea. But look, we have 4 studies in the last 4 years where we gave echinacea under scientific conditions to people who were artificially inoculated with a cold virus. So we could see if it would prevent or if it would lessen symptoms. Every time, with different doses, with different species of echinacea, with different age groups, even testing children, healthy adults, and college students, each of these studies came up that there was no difference. The last one was in July of '05, and it really put an end to the idea that it helps with preventing colds or with treating them once they're there. So I'm sorry for that. I feel bad about that. I would rather it, be positive. On the other hand, if someone has a lot of confidence in it, they've taken it, if it's not too expensive and you can afford it, I'm not going to say that it's a terrible thing. Are there any side effects to echinacea?
That was my next question.
Just because echinacea is natural doesn't make it safe. The single greatest cause of preventable death in the United States is a natural product. It's called tobacco, if you've ever heard of that. And echinacea is a natural product. It's got lots of different stuff in it. The good news is on these trials that were done on a scientific basis, not just a manufacturer saying, oh, we gave it to people and they all felt better, but really well done. The good news is not a lot of side effects showed up compared to the people who were receiving placebo, the product that didn't have the echinacea in it. That's reassuring. However, echinacea is from the same family of plants that ragweed is from.
Oh, really? That's interesting.
Right. So if you have severe allergies, particularly have a ragweed allergy,
might be best avoided.
Gosh, I sure wouldn't be taking it. So, who knows what the long-term consequences are? I don't. And anybody who says that they do, they really need to publish that information so the rest of us know.
So it sounds like really it's best to just take what you need to and what's absolutely required to make yourself feel better on a very basic level as far as over-the-counter medications. If you can live without it, it's better to maybe do without it.
Right. The one that I don't feel so good about are the combination things that say this relieves 74 symptoms, whereas our competitor only relieves 51 symptoms. Come on. That means that you're taking multiple drugs, not all of which that you need. So I'm unhappy with those products, and I would rather people, if they want to self-treat, just to pick the thing that they need. If you need a decongestant, pick a decongestant. If you need something to reduce your fever, pick that product.
Single source products.
Single ingredient.
Right.
Single ingredient products.
What about having the pharmacist be part of that selection, making that decision to finally buy something? Do you feel that, of course I advocate, I have my own feelings, but I want to hear your opinion as to how the pharmacist can help with that selection and prevent danger with other medications?
Well, certainly the pharmacist can't be in the position of diagnosing, because New York state laws say that's practicing medicine. So I don't think that consumers should put the pharmacist in the position of, does my throat look like I have a cold, or is this a cold? However, a pharmacist is there really to offer advice on product choice, maybe between similar products, or to match it up to a symptom. So if someone said, look, I want a decongestant, what are my options? A reasonable pharmacist should be able to say, we got 10 things here that fit that bill. Here they are right there. Here's the prices. Here's potential consequences. I would like to see pharmacists engaged more in that. Pharmacists are very busy, just like physicians and other health practitioners are busy, but we need to be able to serve the consumers. And consumers need to ask, because it's hard to kind of insert yourself into someone out there looking around for stuff and say, let me help you. We need the consumers to ask also.
What stands out in your particular practice setting as one of the higher risk over-the-counter medicines with patients with multiple disease states? Blood pressure abnormalities, diabetes. What would be, give me some suggestions of things to potentially avoid in cases like that. I'm thinking of one, Sudafed being concerned with patients who have blood pressure, which I'd like to touch on after our next break, just about the new legal ramifications of how to obtain and where to store Sudafed. But give me some ideas about what your
I know you're the host of the show, and I don't know exactly what you want me to say on this particular one. I don't really feel too bad about anything. I don't even feel that bad about Sudafed for the reasons that you just mentioned. Yes, it might raise your blood pressure a little bit. Caffeine raises your blood pressure a little bit, and lots of products contain that. But if you're only raising it a small amount for a short period of time, that's not the problem with high blood pressure. The problem with high blood pressure is when you're raising it for months or years, and that's not how you take Sudafed. Or when you take it and then go have somebody measure it and say, oh, it's up 5 or 10 millimeters, and then they think that that's a sign that it's changing and might change the medication, might change their high blood pressure medication. That's more of a concern. That's a small set of concerns. The bigger concern about pseudoephedrine and cough suppressants that contain dextromethorphan or DM is the potential to take those products and take the ingredient that's in them and divert it to the manufacturer of drugs of abuse.
For illicit use or misuse. Well, that's a perfect segue into our next topic of conversation. So I remind you, it's a call-in show. We'd love to hear from you, 434-1733. After the next break, we'll be talking more to Professor Bennes about Sudafed and other over-the-counter remedies, and we'd love to hear your questions. So we'll be back in just a bit.
I am an American soldier.
I am an American soldier.
I am an American soldier.
I live the Army values.
I will never
accept defeat.
I am disciplined, physically and mentally tough.
I am a professional.
I am a professional.
I am the guardian of freedom
And the American way of life.
I am an American soldier.
I am the Army National Guard.
Defend freedom. In the Army National Guard, you can. Visit 1-800-GO-GUARD.com today.
Western New York Tonight is brought to you in part by Pruden and Cant Funeral Home, 242 Genesee Street, Lockport, New York. And by Central Business Systems, 285 Kenmore Avenue, Buffalo, New York. And by Edward Jones Investments, 53 Elizabeth Drive, Lockport, New York.